officials are keeping a watchful eye on the Omicron variant.
There are a lot of questions on this strain. Joining us live is Dr. Richard Kang, Medical Director of Pediatric ICU at Dignity Health at Northridge Hospital. Dr. Kang, thanks so much for being with us this morning. The number of Omicron cases in the U.S. just keeps growing. Some have been from people who they were vaccinated. They were even fully boosted. So in those individuals, the symptoms were mild, and some might draw the conclusion that, the vaccine, it's not effective against the Omicron. But could it be evidence that it is effective, and maybe that's why they had such a mild reaction? What's your take on this?
Yeah, although we need more data, I think it does show some evidence that the vaccine may be protective against the Omicron virus because none of those patients are seriously ill. We've seen no hospitalizations in the cases that we have detected in the U.S. So again, the vaccine was never meant to prevent you from getting it. It was really to prevent you from getting seriously ill if you contracted the virus.
And Dr. Kang, what is the most important thing people should keep in mind as news of this latest variant raises concern?
So I think, again, it's important, as Dr. Fauci has said, and as the AAP has recommended, to get vaccinated. If you are eligible for the vaccine, to get vaccinated, that would be the number one protection against the coronavirus, including the Omicron variant.
One question that many parents have is whether or not, young kids have the same side effects or reaction from the COVID vaccine that many adults have experienced. So as a pediatrician, you've probably heard the same question many times from your own patients. What's the answer to that?
So at least from the data that was released and reviewed, it shows that children did have similar. They had pain at the injection site, maybe some fatigue, headaches, and chills. There was less cases of fever among children who got, among the younger children, 5 to 11, who got the vaccination, as opposed to the older children and adults. There are no what's important was there were no cases of myocarditis or inflammation of the heart in those children, and that was kind of promising. So the symptoms seem to be less severe than in the older children and adults, for sure.
Good to know that the kids' cases or side effects are less severe. Thank you so much, Dr. Kang, for joining us. We appreciate it.
Thank you for having me. Thank you.
Have a good day.